Hi there, I am Kalia Hunter, an evolving human, healer, and psychologist, here to share some insights on a nuanced topic within women's health. With human beings having undergone constant stages of evolution and unfolding into their current societal dispositions, we have grown in many ways to embrace diverse human expressions. And yet, at the same time, it is easy to find long-standing areas of stagnation in our collective thinking. For instance, our disposition towards female reproductive health is a notable area of contention, which often garners reactions of squeamishness or aversion. When taking into account the topic of menstruation in particular, many consider the topic taboo and diminish the substantial impact that this cycle of female existence can have on one's overall well-being. For the sake of not only providing a safe space, informative, and an open space for discussing this ever-present and natural phenomena, but to also provide resources and support for those impacted, I will be discussing some holistic recommendations for supporting menstrual pain relief. Specifically, I will be sharing some resources for women with dysmenorrhea via a combination of alternative healing modalities. While most of these recommendations are supported by scientific research, of which I have provided the links for those interested in doing a deeper dive, the latter end of this video will primarily entail recommendations based off of my own personal experiences and insight. With that in mind, please consider that you can take or leave what resonates with you and your unique composition, and hopefully you will have some positive takeaways to put into future practice. For those who are unfamiliar with the term dysmenorrhea, a standard Google search depicts this condition as the experiencing of severe pain during menstruation. This can often lead to symptoms such as severe cramping pain in the lower abdomen, back pain, nausea, vomiting, diarrhea, and fatigue. While the medical term may be unfamiliar, Baksh and associates found that 50 to 90% of women of reproductive age experience dysmenorrhea, and about 80% of women deal with some level of menstrual pain or discomfort during their cycle. With this, the recommendations provided can aid whoever finds themselves wanting menstrual pain relief, whether they have been formally diagnosed or not. In the days leading up to one cycle, holistic steps can be taken to decrease the pain one is likely to experience during menstruation. This can take various forms, which seem small in the grand scheme of things, but ultimately have a tremendous impact on one's overall health during and outside of menstruation. For example, to help alleviate painful menstruation, diet modifications can be supportive in various ways. Specifically, Dr. Hawk, in her article published in 2023, describing what foods to eat and what foods to avoid during periods, described focusing on anti-inflammatory foods that are rich in omega-3 fatty acids, calcium, and magnesium, and to limit inflammatory foods such as processed foods, caffeine, and red meat. In addition, for those who are open, various traditional Chinese medicinal herbs, such as one suggested in Bento Lila's 2021 publication, can also have substantial effects on decreasing menstrual pain. However, holistic support does not stop with diet. An article found on the menstrual cycle and ovulation tracking app called Flow, the app that I personally use regularly, noted that stress and anxiety can actually intensify the pain and discomfort experienced during one cycle. In order to combat this, various measures can be taken leading up to one cycle, as well as during one cycle, depending on one's comfort level and openness to alternative healing modalities. Chen and Associates, in their 2024 publication, found that techniques such as acupuncture and acupressure can be helpful for decreasing accumulated stress and tension, regulating hormones, and decreasing the severity of symptoms experienced during menstruation. For those who may be averse to the idea of needle-based techniques for healing, a combination of massage therapy and acupressure can work wonders for relieving external and internal discomfort surrounding menstruation. When taking into account acupressure alone, this technique is one that is likely to be the most cost-effective modality, considering a plethora of books and online resources are available to guide interested individuals through the steps required to achieve menstrual pain relief. While treatment experienced directly from a trained professional is always preferred, funds, access, and availability may not always allow regular sessions to be a viable option. With that in mind, resources such as Dalet's Acupressure Self-Care Handbook can prove to be very supportive in these instances. In turn, the following recommendations are based off of my own personal experience and may not be suited for everyone, considering every body is different and has its own specific needs. But if any of these recommendations happen to resonate with your experience and or interest, I would highly recommend giving them a try, and I am here as a resource to direct one to more detailed evidence supporting the efficacy of these techniques. During the week leading up to my cycle, before the onset of symptoms comes to the forefront, if funds allow, I take this opportunity to get a massage to relieve accumulated tension, tightness, and stress stored in the muscles. When funds are not available, I opt to practice intentional stretching techniques for opening the hips and relieving tightness in the legs in order to encourage flow and openness for my menstrual days. In addition to physical efforts, I make it a point to decrease dairy intake, which tends to worsen my cramps, decrease caffeine intake, and lean into warming foods and drinks such as baked root vegetables, sauteed spinach or kale for the iron support, and raspberry leaf tea for menstrual cramp relief and hormone balance. During menstruation, if funds allow, I seek acupuncture care from a trained professional, which helps with holistic balancing and relief. However, this can often be a costly occurrence, so I have found equal relief from continuing my stretching and dietary practices, in addition to utilizing acupressure techniques, which follow the same points of focus as acupuncture and aid tremendously with overall pain relief and relaxation. In addition, I make it a point to assure that I am meeting my daily water intake goals of half a gallon or a full gallon if I'm on top of it, and push myself to go on walks or engage in some light exercise to support my holistic well-being and encourage the flow and ease of symptoms. To conclude, while the combination of these alternative healing modalities has proved pivotal in providing relief for my arduous menstrual days and holistic well-being, I recognize that it may not be as poignant and impactful for everyone. Nevertheless, I hope these resources provide helpful and informative support for your own menstrual self-care, and I will continue to be present as a resource for those interested in a more detailed understanding of the resources I have used for scientific and personal support. Thank you for listening, and I hope you have a wonderful rest of your day and an ease into your menstrual days. Be well.